Welcome back. I'm John Pettinger with Chamber Connection, and today I'm here with hopefully I won't mess this up, Dr. Anthony LaVacca?
Yeah.
Okay. And tell me about yourself and your dental practice.
Well, my dental practice is pretty much geared to prosthetic dentistry, implants, and cosmetics. My wife and I, who is an orthodontist, who specifically does braces, we decided to, rather than be apart during the day, join forces and open up Naperville Dental Specialist and General Oral Health Care.
Oh, good. It sounds like a good combination.
Yeah, it's actually really great because we have her treating the younger children with braces and adults with the new Invisalign technique. And then they come over to see me for their implant placement, their cosmetics, their veneers. So it works out really well.
So you have a wide spectrum of ages through your practice?
Absolutely.
Okay.
We also hired Dr. Miranda Albert, who's a board-certified pediatric dentist.
Oh, okay.
So we treat the kids, the adults, and it's all in one-stop shopping. So they come to the office and they can be treated from the very young to the very old.
Wonderful. Let's back up. Before we started, you said that you were from New Jersey.
New Jersey, Bloomfield, New Jersey.
Bloomfield, okay. Yeah. And then you went to Rutgers for undergraduate, did a little wrestling.
Yep.
All right. And then from there you went
to Temple University, and then after I received my DMD from Temple, or my dentistry license, I went to the East Orange Veterans Hospital.
Okay.
Where I treated the veterans for a year, and then to Montefiore Medical Center in the Bronx, where I trained for it's called prosthodontic dentistry or prosthetic dentistry.
Okay.
And in there I learned how to place implants, restore implants, and then when I finished, after being chief resident, they asked me to come back to run the whole entire department at the hospital.
Teaching?
Yeah.
Wow.
That was a lot of fun.
And you did that for?
I did that for a total of 4 years.
Okay.
Yeah.
Wow. And then, so you're East Coast, now we're here
How did I get here?
Yeah, how'd you get to Naperville?
Well, I met my wife. My wife, before she was an orthodontist, was a prosthodontist, another specialist, and we met at a conference. So then she came out to New York to do her orthodontic training, and then we decided to have children. So,
okay.
And I said, oh, you know what? Your whole entire family. We had 450 people at her wedding. Yeah, it's a big family out here.
Wow.
So we moved out here to have the family support for raising our children. But hey, I'm from New York. I'm moving to Chicago, the second best city. I'm never moving to the suburbs. Well, let me tell you, after having a 1-year-old and a 2.5-year-old, shipped me out to one of the best suburbs around. That's Naperville. So.
Yeah. Was your wife from this area then?
Yeah, she's from Warrenville originally.
Okay.
Yeah.
Wonderful.
Yeah.
And now your office is at the Main Street Promenade.
The Main Street Promenade, above Hugo's Frog Bar.
Okay.
It's the second floor level. And as you come up the center elevator, you can either go to the left to Dr. Ibrahim's office, the orthodontic pediatric side, or to the right to the adult side, which is my side.
Okay. So, and what's some of the latest trends in dentistry, and how do you want to, which I should say, what are the latest trends, and then what type of clients are you reaching out to be a part of your practice?
Yeah. The latest trends now are implant and implant placement, especially helping the elderly people, denture sufferers. Some of you had a denture for 5 or 10, 15 years. No bone left to support the denture. What I do is place several implants in the bottom or top jaw, and I stabilize their denture, and it allows for them to eat, chew, and function better. In our facility, we actually have a surgical operatory, which is a teaching institute too. So we're teaching other doctors how to place implants and restore them. We're also incorporating a laboratory component, so we're going to be making the dentures in our facility within a few months.
Oh, nice.
Yeah, so the patients come in and have the implants placed and the prosthesis placed the same day. But we also are not just denture oriented, we are a very high-tech cosmetic office. Porcelain laminate veneers, white fillings, things that are very cosmetic in nature. But we like working people up because sometimes people come in for routine dental care, don't know their options. We present them their options, and then that's where they take their choice. They may want to just do functional dentistry, or they may want to do highly aesthetic dentistry, and that's what we offer.
So it sounds like you put together a comprehensive plan.
Yes.
With all the different options
Absolutely.
to choose from.
And then that's what we do with our new computer system. We put together all these plans, option 1, 2, or 3. Talk to the patient about what they can have, I find out what their subjective needs are. You know, what do they really want? Do they just want 1 or 2 teeth fixed and that's okay? or are they looking for the whole smile makeover?
Yeah. Well, it seems like a lot of people are, it's nice that we have that option these days. It seems like dentistry, as everything else, has just fast forward with all the different
To
technology.
cosmetics, yeah.
And it sounds like you're also shortening the time frame.
What's nice is we have everything pretty much in-house, so we're able to give that patient a service that's done a lot faster versus something that is done over 4 or 5 or 6 different visits. So we take them from start to finish. We have them in the office, and we give them the convenience of relaxing, sitting there and doing the work as it goes along.
It's got to be pretty rewarding too to see a transformation.
Oh,
occur.
absolutely. When you take someone who has had a collapsed bite and you don't see their teeth and they're real smushed together, and now you bring their smile back for them, it just, you see patients cry all the time. You know? It's just like, wow, I haven't seen my teeth in 10, 15 years, and now I look absolutely great.
Changing lives and stuff like that.
Yeah.
I do watch that once in a while.
Well, the makeover stuff.
Yeah.
Yeah.
You know, but it's amazing. It does change their life.
Yeah.
It changes their perspective, and
Yeah.
I know that has a huge impact on their personality and their outgoingness. And
Right, when they walk in, they're talking to you and they smile like this, and then they walk out, and after they see their teeth and they come back the next time, it's not only that, once you give them their smile back, all of a sudden they go and they get their hair cut, you know. They have their skin redone, or they're looking for some other cosmetic, and they come back and they look like a completely, totally different person.
because dentistry, you can really take a look inside with the health of a person too.
Yes.
Can't you?
Oh, absolutely. Some of the gum tissue diseases and the periodontal issues, which are directly related to some coronary problems, arteriosclerosis. Some diabetic patients have really bad gums and they need a cleaning more often than other people do.
Right.
So looking into the health is the most important part, because that's the functional aspect of it, not just the aesthetics of the case.
Wonderful. How do people find you? I mean, do you have a website, Yellow Pages, all of the above?
All of the above. We're at NDS Care, www.ndscare.com. Our office number is
Sure.
630-848-2010. And then we're located in the Promenade Building, greatest spot in one of the greatest spots in downtown Naperville. It's a beautiful building.
It is. It's
Right above Hugo's Frog Bar. So everybody goes, "Where's your office?" I go, "Right above Hugo's." Oh, I know where it is.
What a great landmark.
Yeah.
Wonderful. Well, Dr. LaVacca, thank you very much. The Chamber thanks you for being a part of the Chamber. The Chamber is a wonderful organization, as you know, and they're just
We're at the
upstairs.
elite, they're upstairs, and we're like one of the elite level for the Chamber.
Wonderful.
Yeah.
That's great. And NCTV benefits by that relationship as well, and having you on as a guest. And,
Great.
And look forward to stopping by and even seeing your place.
Come on by whenever you want.
It sounds great.
I invite everybody to come by and take a look at the facility.
All right. We'll do that. Thank you very much.
Thank you.
Thanks for being on the show today. I'm John Pettinger. We'll be right back.